It is 12 o'clock, so we will go ahead and get started. We have a couple of new faces on today's call, so I thought we could start with some introductions, and then we will get our updates. I know Tisha has a busy Friday, and so she's, I think, double booked, so we'll let Tisha go first and give her updates. Hopefully David Jones will be able to join, give us a couple of updates, and then we'll hear from the FQHCs, what's happening with them, and anything else that we want added to the agenda or we need to talk about. We're pretty familiar with each other now, so don't hesitate to just add things and say, this is what we need to do. So with that, why don't we do some quick introductions so we could meet some new folks. I'll start. I'm Kim Schuler, and I help facilitate the CoCM stakeholder meeting, and I'm the CEO for the Arkansas Behavioral Health Integration Network, and I'm so glad all of you are here with us today and sharing this passion on getting CoCM in Arkansas and spreading across Arkansas. So with that, I will just popcorn it over and call on someone. I'll call on you, Tisha. And we can't hear you. No worries. We could popcorn it to Teresa.
Hello, everybody. So I probably don't say it enough, but thank you for participating in this project. We are officially in year 2. Yeah. So we are, so here's what's happening at sort of the operations level. We're trying to make sure we execute all the year 2 contracts, and that's seems to be moving along fine, but if anybody knows of a problem, please contact me and let me know. We did have significant carryover funds from last year. And so we are first going to figure out what each of our sites and each of our subcontracts needs to make this year successful. And then look at, do they need their carryover from last year? Do they not? What do we need here at UAMS? And if there are sufficient funds, we would really love to bring another clinic on board. So we don't know yet if we'll be able to do that, but that is something that we're talking about. We've talked with ABIN and perhaps you, Tisha, I don't remember, I'm sorry. But it doesn't have to be an FQHC, but it does need to be a clinic that is in an area of Arkansas that's really a mental health professional underserved area. And so we're looking at that. So that's kind of exciting because spreading this to another place would be great. The state is very supportive of doing that. Probably the other thing that the state has said to me recently that has given me some happiness is that they have, really, they have intention of bringing the codes, of opening the codes to allow Medicaid to be billed for CoCM. Apparently getting the approval for those codes and processes is a drawn out affair, but most government things are. So I believe they told me they wouldn't expect anything. I want to say till 2026, Kim, but I can't remember. I had the number in front of me when I last spoke with you, but now I can't remember the exact number. So anyway, it's not there yet, but it's moving along nicely. And I think that's all I know of. If our project manager here at UMS, Amanda Lunsford, is on the phone, Amanda, have I left anything out that I should say?
I don't believe so. I think that's pretty much covered.
Have I left something out you know of? All right, then that's it for me.
So can I just ask, is there an opportunity for new practices to engage in this?
Yeah, yes, so, what we're doing is making sure the clinics that we started with, or the practices that we've started with, have what they need and are moving forward. And then, assuming we have them sorted out and know what they need, then we're going to examine what our carryover looked like from year one, how much carryover we have, and think through what we've planned for the future years, and do our best to see if we could fund at least one more clinic. So yes, there's a potential opportunity, and so we're working to sort the funds out, because I don't want to make promises I can't back up. I did finally, is that what you need to know?
Yeah, thank you. Helpful.
Okay.
Awesome.
There is one other thing I should have said probably. One of the things we added, so SAMHSA projects always have a SAMHSA mandated evaluation. And that is really straightforward about, mostly it's about how many patients did you enroll, and did they get better as they received CoCM. Those are the main topics in that. But I realized that implementing this is perhaps sounds a whole lot easier than it is. And so we had a couple of people already on the project, and then I was able to budget for a little time from a third person to really engage in an implementation science type of evaluation, to really identify and collate the barriers that we run into when we try to do this. And when I say barriers, I don't mean that somebody told us not to. I just mean that sometimes problems that we run into when we try to do this, and then how those were solved, thinking that would be useful to other practices across Arkansas as well as other states. So that is a new thing that's going on with us. And I apologize that it took me so long to remember.
Oh gosh, no worries, Teresa. Thank you. Thank you for that great introduction and for the update. My thoughts are we could do a quick introduction, and then we can we'll move to you, Tisha, for your update. So let's get a quick update since we're on UAMS. Amanda, I don't know if you want to give a quick
Sure. Amanda Lunsford, I'm the project director for the SAMHSA project that Teresa was talking about. So if you have any concerns, just email me about that or questions.
Awesome. And we've also got Michael.
Hi, Kim. Michael Keck, Executive Director here at the Psychiatric Research Institute at UAMS. Also Tisha Dean's driver when she asked. So I'm kidding. Tisha's never asked me to drive her anywhere. Quick word of thanks to everyone. Although I would be willing, if Tisha ever asked, I'd be happy to do it.
Good to know.
Quick word of thanks to everyone. I know many of you were both at our recent schizophrenia conference, as well as our conversation with Sam Quinones, and thank you all for being a part of both of those events. Be looking forward to an announcement coming up soon. I'll tease with that. I don't have any specifics other than stay tuned. So there.
That's intriguing. All right. Let's pass it over. We've got Nicole. We've got you on from Mindula.
Hi, thanks, Kim. My name is Nicole. Today is actually my last day as the senior program manager over at Mindula Health. I am here as just another collaborator and one of the sorry, many individuals that partner here to help advance advocacy for collaborative care. I am going to be moving to a program that is mainly in the state of Texas, but I do hope to stay in touch. So this is probably my last time here just because I won't be working with Arkansas as much as I am currently, but it has been a true honor working with this group and really just collaborating with all of you wonderful professionals. This has been such a wonderful space, and I'll actually be moving in the direction of advocacy, and this was my first taste of that. So I really appreciate you all for just bringing me in here and, giving me a taste of something I'm really interested in. So thank you so much for that. I am going to be bringing in my one of my counterparts, Sarah Matsumoto. She wasn't able to make it today, but she'll be at the next one of these. So you continue to have some voiceover from my doula health, and we can help to collaborate in any of these future projects.
Wonderful. We just want to say, Nicole, thank you for your participation in this work group. We have really greatly appreciated all of your input and have learned from you, and we're excited to have friends in Texas. So we'll be able to hear what's happening in Texas and stay connected with you.
Yeah, and if we ever open up in Arkansas, I'll be reaching out and saying, "Hey, I wanna hang out again, you guys." Just so we can all stay in touch. But I really appreciate it, truly, and yeah, I really look forward to hearing Medicaid letting us bill over here in Arkansas. That's exciting.
It's
Um,
exciting. All right. And we've got Sarah.
Hey folks, I'm Sarah Burns. I work for the University of Michigan Department of Psychiatry for a team called PRISM, but I am based in Phoenix. Our team does collaborative care training and technical assistance across the state of Michigan and a couple other areas. So also here kind of as an outside collaborator, anytime there's an open meeting on collaborative care on Zoom, whatever state, I try to jump in. So thanks for letting me be here.
We're glad to have you. And Sarah shares a lot of expertise and a lot of what's happening in Michigan. So we get to hear what's happening all around the country in this meeting. And then we have Verna, our queen of CoCM. We got to hear from you, Verna.
Hi, everyone. Verna Little, sort of a national advocate and also co-founder for Concert Health. I thought I would share just really quickly. I ran recently our data from Arkansas that I know I shared with you, Kim, but I thought I would call out something interesting. It's just actually under 2,000 patients that we've cared for. And one of the things that I thought was interesting was that there were quite a few patients that were flagged for suicide risk, 419 in total. So it was just an interesting number. 40% of them, we wound up being able to reduce that risk. But I just thought it was an interesting number in terms of what a high percentage it was. So I just thought I would call that out to folks. Of the people that we cared for, 20.1% of them were actually Medicaid patients. 11% Medicare, and 68.5% were commercial. Some of them under 11, a majority of them in that 31 to 64-year-old age range. So just thought I would share that information.
Absolutely. So important. And, I think suicide awareness is something that we know of. We were just talking, I was just here at a conference, and we're talking about Arkansas has the 11th highest suicide rate.
Yeah.
When we look at, that adolescent population, I think it was the second leading cause of death. And so it's something that's extremely important for us to be aware of as a work group, because we're coming together, we're talking about needs in Arkansas and how do we collaborate to come up with solutions. And so if we don't have this information, we don't know the problems that we need to be addressing. So critical.
Yeah. And it's interesting because your 10 to 14-year-olds are also climbing. You're actually higher than that, I believe, in your 10 to 14-year-olds.
Okay.
Although I would have to double check it. And I think it's still firearms is the leading cause of death for them and the geriatric patients. So it's the leading cause of death is firearms. But I think it's an interesting I think it kind of shows that really asking people directly about suicide is really helpful. But the fact that there were well over 400 patients in that just under 2,000 cohort. I mean, that's a significant number of people. And I think it speaks to that if you're really implementing collaborative care, to really think about what your suicide care pathway is going to be. And like now in a lot of states or places, like some of the SAMHSA grants, like in New York, they require a suicide care pathway in addition to a collaborative care pathway for participation in that grant. So I think it's helpful. And I think, I've shared a pathway that we did for collaborative care and suicide. If people want it again, I can certainly share it. But just calling it out again. So certainly glad to be here, and always glad to be in meetings with all of you. It's lots of fun.
Absolutely. And for the sake of time, I'm going to move to you, Tisha, just so you have an opportunity to introduce yourself as well as get your update in.
Thank you, Kim. Thank you. My name is Tisha Dean. I am a psychologist by training. I'm the Director of Behavioral Health Integration at UAMS, and kind of the project director for implementing in this project in primary care at UAMS. And really, my updates are that we're going to have a busy October. We have our two behavioral health care managers, Khadijah and Jennifer, are up and rolling and doing really well. We had the offer letter signed for Dr. Sokol, who's going to be our second psychiatrist that's going to be involved. He actually came and visited with us this week. He was here yesterday. No, Wednesday. Whew, this week has been crazy. He was here Wednesday. He actually lives in Texas, but he was on his way through and he stopped by and visited with us, and it was really great to get to meet him. So as soon as we can get our ducks in a row, he will be starting. And so we'll be able to start rolling out to other clinics. We have two new behavioral health care managers one will be starting on Monday. Her name is Carson, and the other one will be starting October 28th. Her name is Samantha. And we also have hired an administrative support for our team to help deal with all the hiring and onboarding and making sure that we're collecting the data we want to collect, and creating all the documents we want to create, and organizing everything in a way that's efficient and nice. And her name is Cato, and Cato has a master's in public health, and she is absolutely awesome. So I'm so excited to bring her on board. And she will be starting probably in December. She's got some moving housing issues going, and so she wants to kind of get everything settled before she starts. But we're really, really excited about adding her to our team. And we're also really, I think, have got set up and are giving our data, the information that we have for whenever we enroll patients, to the evaluation team. We've got a good system for that, and I think that information for SAMHSA is being collected. So that's what we have for UAMS.
That's awesome. You guys are doing such a great job and moving this along. One thing I was just curious, I wasn't here last month, but I listened to the recording, and I know you had referenced, you guys had done some development of trainings with the Ames Center, and was just wondering, we're about to get started with trying to develop some training components as well, and didn't know if you would be able to share those components. We're not sure that we're going to be developing videos, but it might be really nice, and especially as the different FQHCs start onboarding, we know at different times that people come and go, and so if there could be durable goods that are training videos, that might be helpful. So just wanted to check in with you on that piece.
Yeah, so the trainings and that development was through the second Blue and You grant that we got. So it actually started before this project. And I checked with the AIM Center, and it's actually kind of their proprietary information. Like, we contracted with them to develop the trainings for us, so I can't share those recordings. Um, I did talk with Monica Harrison, and she said that that the AIM Center has worked with other states. So they worked with New York and worked with other states to create specific trainings that would be part of like a more durable, shareable situation. So that's definitely an option. But
Okay.
I did check. And I was like,
I
I
also,
know.
just to jump in, got a little bit of money, and we're going to be recording some trainings, particularly peds like ADHD, some others, and some collaborative care, like 15-minute kinds of informational trainings that we'll be sharing for free, and I'll be putting them out on the CFHA website, and folks can just have them. So just, letting people know.
I just
That's
put a link in the
Sarah.
chat to a resource from North Carolina. So the Southern Regional AHEC, they're contracted with the AIM Center to do collaborative care training, and they did put it online for free. You have to create an account, but it's free. I only watched the first 3 or 4 hours. It's 20 hours of content.
Oh my.
So there's a lot there, but check that out because it is from AIMS, and I was able to get to it for free online.
Perfect. Perfect. Yeah. And so this is why this is such a good group, is we're able to look at what are the resources out there and how do we share them. And Verna, we have to say, this is why you are the CoCM queen. You're able to say, hey, I am developing these trainings and I'm spreading them across the country like a CoCM fairy. And when we ask for this, boom, here they are. So thank you for all you're doing. I don't know that I say I appreciate you enough. So
Oh, well, I'm actually more excited about the pediatric pathway that I'm going to be sending out later today, that folks from around the country worked on. Meadows, the AIM Center, a bunch of folks, and it is one whole packet. I'm hoping to literally send it out on the CFHA listserv later today. He would have it, except I had some technology limitations in my ability to get it off of where it was in one piece. So someone's helping me problem solve that, but that's actually coming out later today.
woohoo.
And I'll just say, a lot of the part of what I did is it's just a red cap, like put things together like in a survey. So watch this video, answer some questions, read this article, answer some questions. So a big piece of it is I sent, like, part of it is watch the video that Verna did on ABIN, um, and then answer these questions. And so it's really kind of packaging things together. Part of it is we're sending them to the AIM Center actual training, do the training, and now say that you did this. So it's a piecing it all together. It's not just the videos that we have, from the AIM Center, but it's kind of I pieced together a bunch of stuff that kind of walks them through things. It's also training on the AIM Center, on the AIMS caseload tracker. So watch the videos on the AIMS caseload tracker. Do this thing now. Send me an email and let me know that you've done it, so I can give you access. So it's really just kind of I just created kind of a pathway for them to go through all these things. So I make sure they've done it because it checks it off on RedCap if they've done it, and kind of gives them step-by-step instructions. So I'm happy to help,
Now,
in developing something
yeah,
like that.
that's really helpful. And maybe as we get further down the line, we can kind of cross-reference with you, making sure we didn't miss pieces, and there might be pieces we get that you think, oh, this might be helpful. So let's get together and make sure we're bringing all these pieces. Thank you,
I'm going to
Tisha.
hop off. Thank you, everybody. Have a fabulous weekend. See you next time.
You too. Happy Friday. And then we've got Mary Beth Rogers. We've got to have you introduce yourself, Mary Beth.
Hi, everybody. I'm Mary Beth Rogers. I'm the executive director of the Arkansas Academy of Family Physicians. So thank you for keeping me looped in and up to date on everything.
Absolutely. We know that family physicians are key piece of the CoCM model, and we're so glad that you're here and you're representing them, and for your advocacy for CoCM in Arkansas.
Absolutely.
And we've got from our team, we've got Caitlin.
Many tabs open trying to find which one's talking to me. I'm Caitlin Johnson. I'm an LCSW. I am here in Benton, but I do remote project management for ABIN and work with Kim and Misty down there at the bottom, and Dr. Gibson when she lends us her time. She's very busy. So.
Yes. Thank you, Caitlin. And we've got Misty Trent.
Hello, I am Misty Trent. I'm a project coordinator with ABIN on this one and several others. I'm a master's student, so I'm simply learning from all of you incredible mentors and excited to be on this project.
And keeping us organized, and we appreciate you. And we've got our own Dr. Gibson.
I think I know everybody. Patty Gibson, adult psychiatrist, and now been at Blue Cross, Arkansas Blue Cross now coming up to a year as the medical director for behavioral health. And so one thing to really realize, Arkansas Blue Cross is very much of a supporter of integrated behavioral health, and that's why they recruited me to come work for them. I didn't go to school thinking I would go, have a dream of going and working for a payer. But we know that sustainability for all mental health care, and especially integrated behavioral health, really does get down to payment and how to help the clinics be able to change the way that they're providing care. And so Arkansas Blue Cross definitely wants me to continue participating in this project because it's good for the state. And we have done some data analysis of patients who have had claims filed with CoCM, and their overall cost of care does go down and their ER visits go down. So that's something that we're continuing to monitor. So definitely we want as many practices to be utilizing CoCM. And I do continue to work as an advisory on the advisory board with ABIN. So really excited to see what all's happening with this project and bringing in all these folks. And I'm very excited to see Jason and Cyril on this call because I haven't gotten to talk to them in a little while. So Kim, I guess you're going to let them, or maybe you already had them introduced before I got on.
No, we're going to have them introduce themselves now. We've got two new guests today. We've got Dr. Piaget and Dr. Anawaha. And so I'm going to ask Dr. Piaget to introduce himself and tell us a little bit about himself and why he's interested in CoCM and what he's doing in the CoCM space.
Thank you, Kim, and also thank you, Patty. As they said, my name is Cyril. I am a psychiatrist. I'm a co-founder of Woven Clinics with Jason, Dr. Arnua, and we are very excited because we and Eastern Arkansas FQHC have agreed to collaborate, and we will be the psychiatric consultants for their CoCM through the grant. So very excited. Kim and Patty invited us here to help us sort of get a better lay of the land and understand CoCM in Arkansas. So we're really excited to learn and grow with you all in this.
I could follow Cyril's introduction. Good afternoon, y'all. My name is Jason Anawa. Like they mentioned, I completed my psychiatry residence here in Chicago. I'm originally from Florida, where I went to med school and did my MD and MPH. So I'm super excited about being a psychiatrist, working in the collaborative care space, and just helping folks get access and really to high quality care. So super excited about the work you guys are doing in Arkansas, and really humbled and privileged to be able to be a part of that. So excited to meet all of you all.
And we're so glad you're here. And we are so glad that you're going to be working with Eastern Arkansas. that's really part of our update as far as with the FQHCs. As you know, it's challenging to find the right psychiatric consultant who's interested and who can support that team. And so we've been fortunate enough to get to know Dr. Anawaha and Dr. Apiaje and bring them into the project. I think they're going to be amazing. I have to just say one of the things that I thought was really cool as we started talking to you was that you've had the opportunity to get to try out CoCM in your residency. And so sometimes it's really challenging to think about and try to convince someone why CoCM is a great model and why that they would want to practice. But you all have had already have had that opportunity and found you really love this model and this is what you want to do. So I think that's really great. And then to hear your heart for working with really underserved populations, especially, Eastern Arkansas, we know that they're located in the Delta. And so a lot of that work is happening in those underserved areas. And so we're just excited to have you here, and we'll be bringing you to Arkansas at some point so that you'll actually get to meet the staff and meet the care team. I think that's going to be a critical piece. So yay. That's the big update that I think we are now bringing in all of the different pieces of the puzzle for CoCM for the project. So I know it's taken us a little while, as Teresa has said, but I think we got a solid foundation, and the next couple of months we'll be able to get everybody onboarded and start seeing patients. So that's fantastic. Okay, another thing I have to brag on is Teresa has been working really, really hard with her team to make sure the sustainability plan was completed and submitted. And so thank you, Teresa, and your team for getting all of that done. Those are actually really hard components, but they're necessary components. SAMHSA won't allow us to continue going forward if we don't have all the documentation appropriately in and approved. So thank you, because we know sometimes we don't see all the behind the scenes work, but there's a lot happening to make sure that this project is successful. So Amanda, Teresa, thank you all. Okay, so those are really, some of the updates. We could tell the foundation has been laid, teams have been hired, both at UAMS and the FQHC, and we're getting ready to launch another piece. Eastern Arkansas is ready to have the data collection team come out and train them on data collection. So once we get Dr. Jason and Dr. Cyril on board, that piece will get started. I know, and just in putting this out there, and you all probably know this better than me. I haven't been watching this as closely, but we're getting ready to have this legislative session. And so thinking about, is there anything that needs to happen with any of the CoCM codes? I know that the promulgation has started and those will be turned on in 2026, but any other type of advocacy or anything that we can do to be helpful? Just wanted to throw that out there so we can brainstorm for a minute as a group on ideas. Vern, I know you've given us a lot of articles and information, and we have been providing that. Tisha and Caitlin and Dr. Gibson were at the last legislative meeting. I was not there. I don't know if y'all want to give any kind of update on.
Kim, did you share the letter from CMS recently that advocated for states to include the CoCM codes? I'm pretty sure I shared that with you. because particularly, I think it's on page 36 and page 44, it actually gives a directive from CMS pretty clearly to encourage the states to adopt the codes. And I would also say, since CMS changed the 99494 from the limit of 2 to the limit of 4, that you make sure that that gets, if they are going to put a limit on the 99494s, that you actually make sure that they know CMS changed the guidance to be 4. So those would be two things that I would say have changed recently to try and call out.
We'll definitely make sure. I'm not certain about the codes increasing from 2 to 4, so we'll definitely check on that and make sure we're advocating for that. Monday is when they have the next meeting. So thank you, Verna. That's extremely timely, and we'll make sure that we have that recommendation.
Can I have a question?
Yeah.
When I worked in VA, there were some specialty clinics. The GI clinic, I think it was more like hepatology, and I believe the HIV clinic. So specialty clinics implemented CoCM because they do so much primary care for their patients. Are there any clinics in Arkansas who are thinking of doing this? And if so, has Medicaid even, I've not thought to ask Medicaid if they would allow those clinics to bill once they turn the codes on.
Dr. Gibson.
Well, as far as that answer, I think that any provider, like that Verna has said, CoCM codes are billed by any medical provider who can do E&M codes. So the specialty doesn't matter. So as long as they are a a provider that, whether it be a nurse practitioner or physician, and they could be in any specialty, can bill those codes. They just need to have all of the criteria that are delineated in the CMS guidelines as well, as far as a registry, case manager, case reviews, and that type of thing.
Okay, thank you.
And I had raised my hand. I was going to ask David, he may have already said something, and just see if David, if you all, does Medicaid need anything specific to help them with the promulgation process?
We probably will when we get to that. The only thing that I've been able to accomplish since our last meeting is actually talk to somebody to do a very high level outline of what needs to be done. And me and the person just assume that we're going to have to do all of that, because it's better to assume that you have to do all of it than be surprised that, oh, wait, I don't have to do that, and speed up the process. So once we get further down the road, yes, we'll definitely be reaching out to you guys on helping out with any kind of data recommendations. Once again, limits, if a code needs to be limited, we'll be relying on you guys to help us out on that.
Awesome. And my apologies, David. I didn't see you on the squares, and sometimes it's hard to pay attention to the participants. So thank you for sharing that update. And please know that we are here as a work group to support you through this process. And so this is exciting. I mean, this is a big deal for us to be considering Medicaid turning on codes and this happening within this project. So, knowing we have national experts on today's call, and not just today's call, but Verna has been such a help. We have CoCM friends across the country. And, as we go to different meetings, we get to hear about, here are things that we're struggling with, and here are successes. And so we know that this process it's not an overnight process where we just flip a switch and all of a sudden everything falls into place. So I just want to say thank you, because I heard you say you and one other person are thinking about how do we design this and how do we go through all of the reporting pieces and administrative bureaucracy to get this done. So please know you're not alone, and we will support you every way we can.
Yeah, that's great, because as I said, we'll definitely be, once we get to to the details, yes, we'll definitely be relying on this work group to help out. But just, let everyone know in the real life, it's going to be a long process. There's so much to do, and time frames and waiting. A lot of it's just turning in things and waiting for it to get approved. So, but hopefully, as I said, hopefully in 2026, that was a conservative date. So hopefully that would be, the latest we would do it. And if everything falls in place, hopefully we could do it sooner, but we will see.
Yeah, no, that's great. And we know that I think 22 states Medicaid has codes turned on, and so we're going to be in good company getting our codes turned on for Medicaid in Arkansas. And I'm just curious, I have not gotten any firsthand experience with other states, but Verna, you might have experience and you might be able to speak to what was it like, and was there anything that was helpful in that process for Medicaid, as you saw different Medicaid in different states working in the process?
I think Verna might have had to jump off.
Okay.
I actually have some exposure to
That would
Medicaid
be
being
great.
turned on in a couple of states.
Yeah,
if that's
that would be
helpful.
great, Nicole. We'd love to hear it.
Glad I can, have something to say in this last meeting. That's nice. So we had Maryland Medicaid turn on. There was definitely a lot to monitor first and foremost, just because the codes were added to the list. Initially, it was kind of slow rolling, getting them actually to go through and for the claims to drop and get approved and everything. So I would suggest having a strong contact, which I know this group has, but like if you're implementing it in your collaborative care system with Medicaid, so that if they're not dropping the way that they should, you have a process in place day one so that you know who to escalate it to and get those approved, especially with Medicaid. Those patients, a lot of them do not have the funds to alternatively be able to engage with care if they're not getting those codes covered fully. And a lot of practices get a bad flavor in their mouth if those codes don't go through. So it's really just important that you have a strong process day one, I would say. But all in all, it's been so great for patients. We definitely get a lot of providers that will start to really increase referrals when they see that Medicaid opens up. The patients seem to get a lot of benefit from the program. And I can really say it's a huge selling point to tell them like, hey, this is 100% covered for you in care. That can be such a lift for people and really increase the access to care. There's probably some other things to keep in mind. I know my doula wrote a white paper on Maryland Medicaid because we did a pilot with them before they opened up the codes across the state of Maryland. So that could be something to look for. I'll see if I can get access to it before 5 p.m. today. Otherwise, Sarah could probably support you all in getting access to it in case there's like some learning opportunities. It's been a little while since I've seen it, but it's definitely it's been great, honestly, having it open up. There's just a few things to keep in mind to make sure that once it's approved, it's a seamless process so people don't get a bad feeling from the implementation of using these codes with Maryland Medicaid because we want them to get excited and stay excited and have it work out and know, hey, there might be a few bumps, but we've got solutions for that.
I love that. And we would love to see the white paper and look at lessons that we can learn from that. And who knows, we may be writing a white paper in this project before the end of it. So that could be really helpful for us to look at.
Absolutely. I'll take a look for it.
Wonderful. Thank you, Nicole. And I'm going to turn it over to Caitlin and ask if she has any updates or things that she wants to tell us that are happening about CoCM upcoming.
Yeah, I don't have a whole lot on CSCM, so I figured I'd give a couple of events in case those apply to anyone on the call. But of course, let me see if I share my screen correctly. The CFHA conference is at the end of this month. I know several people on the call are going to this. I know a couple people on the call are presenting at this. So I know it's going to be a good time. We talked to, I actually don't remember who we talked to the other day about the different tracks that are going on. And
It
it's,
was the Ames call, or was it the CFHA SIG, CoCM SIG?
yes, yes. And they were talking about all kinds of different tracks and different conversations that they were going to have. So I think that the agenda this year really fits anyone in any discipline that's interested in integrated care. So that is going on. I'm sure that it shows that you can still register for it. So you are welcome to check that out, and Misty's very good at sending out the links and from this meeting, so you will get those. I did go ahead and open what I think it was Sarah that sent this resource as far as COCM training series. That's available, and we will have Misty send that out as well. And then there was something that came across my email this morning from Misty that sounds like it came from the social work department at her school. But there is actually, if you're in Arkansas, there is a documentary that's being screened in Conway at UCA at the college up there, and it is on fentanyl, and it's actually concentrates on Arkansas and how the South and Midwest are addressing the fentanyl crisis. Which I think obviously fits in very well with integrated care and the conversation of COCM that we're having, because these are typically our substance use disorder population typically comes in to see their primary care to ask for help, and we're usually the first shop for them. So if this is a free event, I signed up for it. I thought that was really interesting. They actually are going to interview people after this, so make sure you dress nice in case you're chosen for that. Again, Misty will send this out as well. The last thing I was looking at our website. We don't have it up yet, but we do have a webinar coming up on adolescence and substance use disorder for our ABIN webinar next month. And let me exit out of this real quick. I actually don't know how to, I think there it is. Okay. Let me stop sharing for just a second so I don't make everybody dizzy from switching between stuff. But yeah, we do have an ABIN webinar on November 14th that's managing adolescent and youth substance use disorder. Kim, could you remind me who the speaker is on that?
Yes, it is Dr. G. And we know him as Dr. G. I'm gonna have a hard time. Maybe
Dr. Gibson's shaking her head too.
Yes. He's with the Six Bridges Clinic with UAMS, and it is an inpatient adolescent substance use treatment program. There you go. Thank you, Misty. We can read it, and he says, just call me Dr. G, and so that's what I always call him. And so he's such a wonderful man, but he will be our November speaker.
Not to sound biased, but I believe he was on that panel that we went to the other day, right, Dr. Gibson? Okay. And he gave such good insight on just when adolescents start to use substances, and which was 12 years old, which I thought was much lower than I thought, or that I knew. And he just gave a really a good overview of what's going on with adolescents in Arkansas, and he was a very approachable speaker. So again, I'm a little biased. It is ABIN that's putting it on, but I think that he will be a very good resource for you to come and listen to. And of course, that's available to register for on our website, and then you can also get on our mailing list. We send out a reminder every month for these calls. So that's what I have for as far as events. If Verna was still on, I'm sure she'd have several things to share, because she usually has her finger on the pulse a little bit better than I do as far as COCM events, but that's what we've got right now.
Okay. Would anyone else like to share anything about CoCM that's happening in your space? Questions, thoughts, or just anything in general that you think is important to share with us? Okay. I know these are virtual meetings, and so I attend a lot of virtual meetings, and I know you do too. And I've been watching people who say, why don't we end just a few minutes early so we can get a bio break, so we can get ourselves settled before we move on to the next meeting? And so I just wanted to say, we'll get ready to close. We are so excited for the different representation. I feel like we've got a solid foundation for this CoCM grant in Arkansas. The past year, we've been, developing workflows, training clinics, finding people, onboarding people, and now we're at the step where we're really ready to implement into clinics. And so my hope is that we could start sharing in these meetings what that implementation looks like, because we know there's going to be some bumps. Every time I've participated in a project, it's never just been smooth sailing, but I think we have a lot of experts here that we can bounce ideas off of and support each other. So I just want to say thank you for your passion for CoCM. And it's gonna spread across Arkansas. And in a couple of years, when we look back, we're gonna say, wow, can you believe all of the clinics that are participating? And we have phenomenal psychiatric consultants who are here that are gonna help lead the way. And so thank you guys, and happy Friday. Have a wonderful week, and we'll see you back in November.